June is Men's Health Awareness Month, and it's a time to bring that awareness and preventable health problems that may face many men and have them talk about it. We're teaming up with Franklin Primary Health to provide some free checkups. You may have heard us talk about that prostate screening that's coming up and BMI checks as well.
That's right.
We have two guests in the house, Mr. Charles Wright and Pierre Good. They're here to talk more about the importance of this. And first, Mr. Wright, you say detection, early detection is key.
Absolutely. Early detection is definitely key. Particularly as we're talking about prostate cancer, that's going to be one of the things that we're going to be testing for, doing PSA screens. And certainly we would like them to come on out. We'll be doing this just a simple blood test. And we'll be, and if they've already found that basically the earlier you get it checked out, they can do something about it. They got medicines and things. It's actually, the rate of prostate cancer is actually going down.
Good.
Because people are coming in. And in fact, a few years ago, we teamed up with you guys and we had over 400 men to come in and to come in actually to be tested. And many of those, of course, we did have a few that actually were positive. And I'm so happy today to say, knock on wood, that they actually all went to, we put them through urologists and cancers, and they are all doing well. So the thing is, so early detection is truly key.
And Mr. Good, I want to bring you into the conversation as well, because you say you know firsthand about the importance of that early detection.
Yes, I had several teammates that ended up with prostate cancer. So about 3 or 4 of them passed away because it was detected late. So yes, it's very important that you go out and get tested.
So what do you think the holdup is?
Well, with me, I waited for a while myself before I went. And now I constantly going to the doctor, getting checked if I feel a little something. It was just the stigma of people saying this is going to happen to you. I don't know if you want to be violated, some crazy stuff like that. And I'm gonna tell you out there right now, it's a lot of guys that still are not going, and you really seriously need to think about it.
Okay, that's a good message. How are you going to follow that up, Dr. White?
Oh, like you said, I'm just happy to encourage people to come on in and get the testing, because again, we will provide that, and we will also provide them and let them know what the results are shortly after it's over, in terms of that, so that they can actually go. And if they don't have a provider, certainly at Franklin, we'll be happy to take care of them and make sure they have, because we have providers that can do that. I want to just tell them all of the different things we're screening for. When you asked the question in terms of why did it go, that's something we generally don't do very much. That is go to see the doctor. Anyway, when ladies go, just looking at Franklin, it's 2 to 1 in terms of the ratio, in terms of the females coming in. And of course, it's kind of interesting. We as men, we're the ones, we actually, well, let's say this, ladies live 5 years longer than we do, according to CDC. And a lot of the reason because we do not go to the doctor. You know, we waited till it's too late to do that. So again, but all of the things that we're screening for, such as diabetes, you know, we're going to be doing the blood sugar there too. So it's so important to come get you treated for that, because then for diabetes, preventing that, you know, we get that early, you know, we can get you started on some medications, of course, to limit you having blindness, or limit you having a toe or something amputated or something of that nature, and then your kidney disease and being on dialysis things. Also cholesterol, you know, come on in, cardiovascular disease and the strokes is number 1, you know, in terms of, and we can prevent that too, in terms of get that, and high blood pressure and things of that nature. Of course, there's pressure on your walls of your veins and stuff. So come on in, we're going to be doing all those tests, and as you said, BMI also, again, because obesity is one of those things. Again, we'll just be letting you know that by simply doing just simply dividing basically
measurements.
Measurements. Just your weight by your height.
Well, thank you guys for stopping in.